Hi, I'm Neil Johnson from the Global Heart Hub. We're an international alliance of heart patient organizations. And I'm taking this opportunity today to discuss with you our recently launched Global Action Plan on Cholesterol. On the back of the recent ACC conference, I'm delighted to be joined today by Selena Gore, Chief Executive from Women Heart, and Professor Daniel Pinheiro, President of the World Heart Federation. If I can go to you, Selena, in 2022, both the Global Heart Hub and the World Heart Federation identified lowering cholesterol as the critical modifiable risk factor to address the burden of ASCVD. You've just attended ACC, and can I ask you, what level of prominence did ASCVD have on the agenda?
I was pleasantly surprised. ASCVD and the cholesterol risk factor and disease state in particular received a lot of attention, a lot more than I would have expected. And it was really, uh, I would say, an important feature of just about every session that I attended. And certainly, important among the meetings that I had with our partners and with cardiologists in general. I think that there is always going to be, for our organization and for many others, this overlay, no matter what the topic is, of looking at special populations. And I hate using that term because women are 50% of the world's population, but in some spaces we are considered a special population. So thinking about ASCVD and cholesterol in the context of women's health, thinking about that in the context of health equity, was a lot of what drove the conversations around ASCVD and cholesterol at ACC, which I was very, very pleased with.
This is the highest focus of the Congress was cardiovascular disease, atherosclerotic cardiovascular disease. But one big change now in this Congress is the focus on implementation, because and to reinforce the communication among different pieces of science, let's say basic science, clinical science, but implementation science. Because it's nothing to know how to treat, in this case, cholesterol, if people don't receive treatment, don't receive the best medicine we can give to them. Yeah.
And I'd like to now talk to you, Professor Pinheiro, about the World Heart Federation roadmap on cholesterol. I think we're all agreed that the global mortality due to ASCVD is unacceptable. Would you agree that the impact and sheer scale of the problem really isn't fully grasped by the general public or governments or society as a whole?
We have to realize that each life, each we lost is a father, a mother, a husband, a wife, a brother, a friend that we need and we love. So we have to see big numbers, but to think individually in the big impact of a cardiovascular disease in the life of people, not just for death, but to have a stroke is a very, very bad thing in our lives. So just to remember that World Heart Federation is engaged. Our focus in implementation, especially in low and middle income countries, but also in high income countries, because the population is very inhomogeneous around the world. So we develop the actually this is the update of the old roadmap we have about cholesterol. Let me introduce the idea of the roadmap. Our idea for roadmap is to think is this is not a guideline, something to guide physicians to treat patients, but it's an opportunity to think which are the barriers for people to get the best treatment, the best management of the disease, and also to think about prevention at the level of primordial prevention, primary prevention, and also secondary prevention, and some special cases, as you said about this in this case, familial hypercholesterolemia. So the idea of our roadmap is to have a document just to work with this document locally in each country, each community, with physicians, but also with nurses, with governments, with pharmaceutical companies, with payers, and also with patients.
Selena, can I ask you, were there discussions at ACC about the importance of detecting and managing high cholesterol and reinforcing the need for action?
Thanks for the question. First of all, it was a fantastic meeting, and I left really energized to dig into this work even more. I would say that high cholesterol and ASCVD in general had more prominent. I was surprised at how much of a platform it had during the course of the meeting, in a good way. It really permeated all the meetings and sessions that I was a part of. And what was fascinating to me was, I think there was sort of the other big strand of conversation at ACC, of course, was around health equity. And so it was interesting to see the topic of high cholesterol dovetail with the topic of health equity, and how we need just more of everything. We need more access, we need more data, we need more research, and we need to understand better the cumulative needs of our population, as diverse as we are. And high cholesterol is interesting because it is both a disease state and it is a risk factor, right? And so that was the conversation is, this, I would say, previously a subjective line between disease management and prevention doesn't really make sense when we're talking about ASCVD. It's more of a continuum. And anyway, I was very, very happy and excited that this, that the topic held so much attention at the conference. And I think it's going to be, a growing priority, both for us as an organization, but for the field of heart disease more generally.
Selena, why, in your opinion, is the Global Cholesterol Action Plan critical? And why is it so important now?
We need a common language. We need a common set of priorities. And we need to know what we're measuring in terms of success. Like, what does success look like collectively and individually, both at the level of the person, the individual, but all the way through to national, and I would say global levels. Having knowledge and having an understanding for how we detect and control and manage cholesterol, high cholesterol. The knowledge isn't enough. We have to have action, right? And so this action plan is not only important, but it's timely. As we see, as we've recognized it for example, at ACC, a much greater awareness and focus on the control of cholesterol. This action plan is sort of the how-to guide when organizations like ours and others sort of look around going, okay, what do we do now? It's sort of like this answer before you realize you had the question, to say, this is what we can do, and this is what we can do all together, which is really key. I mean, as somebody who has worked in the global health space for decades, it's always a frustration when there are 20 different people or organizations going in 20 different directions trying to answer the same question. So this, I would, sort of anticipatory action plan, I think is so well placed and again so timely.
I think we have to increase our communication, to increase our creativity for doing things. Let's say we have a very nice tool for that. That is the hard day, 29 September, to to work. We reach 2 billion people by media, so it's a very powerful tool for activate. Um, so I said communication. I said creativity. I say critical thinking about to and we have a special. Let me introduce for people that are seeing us that we have two very important council in World Health Federation. One is science and the other is advocacy. So I think we have to to be in contact, especially from our advocacy council that now is chaired by Dr. Diana Baca McGee. That is, she is working with the American Heart Association, and she is a very well-known advocate because. But the thing is to think that anywhere we are, we can advocate a little for a healthy life.
Selena, what patient level data or information do you think is still needed in order to push for change in tackling unhealthy cholesterol levels?
Yeah, this is, I mean, so one of the things, as an organization at Women Heart, I mean, we always advocate for is disaggregated data, and that is along gender lines, but especially also along racial and ethnic lines. I was at a session at ACC that talked about the categorization of Asian, for example, and Asian only gets you so far. But when you start to break down Asian, you know that South Indians and Filipinos have a particularly high level of cholesterol and a particularly high level of risk for heart disease. But you would never know that if you just looked at Asian, because in general, if you look at that category, there are lower levels of risk and levels of cholesterol, for example. So it's just it's a really important thing for us to be able to answer the question for researchers. So why bother doing the costly work of disaggregating data? Well, because these outcomes are different. So that's a really, really important aspect of what kind of patient level data we need. But I would say, Women Heart has recently done a study about how women in the U.S. Want to receive information and want to receive support around their heart health. And I think one of the things that we need to consider as a heart disease community is we need patient level data to tell us, what are their other, let's say, non-health related behaviors that may impact their unhealthy levels of cholesterol, right? What are they eating? How are they cooking? What are they? What kinds of, let's say, exercise and rest and sleep are they getting? Like to really sort of round out the picture in terms of the overall heart health of this person. While we're talking about cholesterol, we know we can't isolate cholesterol against the multitude of other risk factors that contribute to somebody's heart health.
I think we have to build jointly. We have to build capacity of advocate because we say to advocate, but the question is what is advocacy, how to advocate, where, when, this kind of questions. So one of our missions, and I say our because I think it's your mission and our mission too, is to build new capacities about advocating. So because I realized that patient group with cancer know very well how to do advocacy, and could be we are a little weak with that. So, but we have room for improvement, and I'm very optimistic about that. But we have to work with, we have to work hard in our alliance, in improving our communication, in improving our capacities for advocate, in to because one thing that we think is good is to for alliance is that if you have to go to the who the key players that are the governments, you have to go with one voice.
Can I conclude by thanking my two guests this afternoon, Selena Gore, Chief Executive of Women Heart, and Professor Daniel Pinheiro, President of the World Heart Federation. Thank you both for your contribution today.